Hours, ranging anywhere from a couple to as many as double digits in the emergency room. It's a story we've heard from multiple people in the area at various emergency rooms.
State data indicates respiratory infections are on the upswing, but a local emergency physician says there's more to the story. Fox 8's Cassie Fambro joins us in the studio. Cassie, why are ERs across our area so full?
Well, Natalie, it's not just a local issue. If you simply Google ER wait times, you'll see stories pop up from all over the country. It's the season for sickness, but another part of the issue is people seeking care at an emergency room instead of their primary care physician or maybe their local urgent care.
Legally, our staff are not able to tell patients what the wait times are.
We tested it, calling 10 Triad ERs, including Cone Health, Atrium, Wake Forest Baptist, and Novant locations. Hi, this is Cassie. I was hoping you might be able to give me an estimate of the ER wait time. Cone Health ER physician Dr. Brian Miller was right. No ER would give us an estimate. Some ERs put a clock on their websites, like these from Wake Med in Raleigh.
What people don't understand is that it's actually a rolling average over the last 4 hours for most of those time estimators.
We spoke to a man off camera who said he was told the wait time at another hospital was 10 hours. And also a woman who said she only waited half an hour and was rushed into surgery. So how do healthcare professionals decide who goes first? It's through triage.
We oftentimes will have one of our medical providers who will actually see that patient very quickly to do a brief exam and to then determine what level of care that person may need.
That initial exam determines how an ailment or complaint is ranked in terms of severity and who gets a bed first.
You know, if more sick people are arriving, we have to sometimes change people's priority based on other things that come in.
Gunshot victims, heart attack patients often taken in ambulances to the ER. How do you know if you should go to an urgent care or an ER?
If somebody's young and healthy, maybe they don't have a whole lot of medical problems, even if they feel like they're having a lot of symptoms, much of that can be handled at an urgent care.
Additionally, Cone Health, Novant, and Atrium Health Wake Forest Baptist all offer telemedicine, giving patients a chance to speak or write to a licensed provider about their symptoms and receive treatment quickly. That step can save a person from getting even sicker.
If you're sitting in a waiting room that has a high density with lots of people, there's going to be people that have the flu, that have COVID, that have all kinds of different illnesses that you don't necessarily want to be around.
It can make things even worse. Dr. Miller says a common ailment they're seeing right now at the Reedsville Cone Health location is all about stomach issues. And with that, there's not a whole lot they can often do. So telehealth is actually a great step to start because you can get your anti-nausea meds quickly and you don't even have to leave your house. Natalie.
Cassie, good.